Call meeting to order. Welcome everyone. Approval of the agenda as presented.
Billy.
Thanks, Bill. Any further discussion? Or no? All in favor?
Yeah.
Carried. Is there any addition?
Yes, an in-camera session.
Okay. In-camera session. That. Anything else anybody has?
Yeah.
Okay.
I would like to talk about the budget a little bit.
Good. Under administration.
Yeah.
Oh, perfect. Okay. Budget discussion and in-camera session. Anything else anybody has? I need a motion. Bruce, all in favor? Carried unanimously. Perfect, thank you. Previous council meeting minutes. Any errors or omissions? Motion?
I'll make a motion.
Thanks, Robin. Any further discussion? All in favor? Opposed, minutes carried. Okay, we have a delegation, two delegations, one from James McDonald. Are these in person or are they?
In person.
Good, okay. One at 9:30, one at 10:30. Alrighty, service board.
There we are.
Hello, James, Shelby, how are you doing today?
Morning. Morning.
Pretty good. Okay, we have the service board report in front of us. Anybody have any questions or comments of these two?
Well, I have one, but I probably think it's not appropriate at this time. Oh, good. This is all done, isn't it?
How was the food symposium in Vermilion? What was that symposium?
So it's a 3-year initiative, and so they're kind of in the early stages. They're not kind of sure what the end result will be, whether that's the formation of kind of a new organization or what. But what they were kind of looking at is trying to determine what the big challenges and barriers and what some potential solutions in kind of the food sector are. So there was a pretty diverse range of folks there. There was a lot of producers, there was a few municipal government folks, some Alberta government folks, just quite a mix of people, and just kind of getting people together to have a conversation and try and identify what some of the barriers and solutions could be.
And there's another 2 then?
Well, it's a 3-year pilot, so they got a grant to kind of go with it. So they gathered a lot of information, and we worked in kind of small groups to kind of come up with some either kind of suggestions or challenges, so they could kind of narrow their focus down and then build on it from there.
Okay, perfect. Thanks.
So you hosted a 2-day egg drone school in Edgerton,
Correct, yeah.
and you now have a basic RPAS license, or what does that stand for?
So that's the remotely piloted aircraft. Hold on. I can't remember the system.
What, you can't remember what
So
yet?
drone, yes, drone, sorry, yeah, that's the formal tone for drone.
So do you need that license to fly all of them?
Yeah, so it's under that certain weight, I believe it's 250 grams. You don't need a drone license at all. So that's those kind of toy-sized ones.
Yeah.
And then anything larger than that, up to the 25 kilograms, you need a basic license to fly. And then there's a lot of other kind
Which
of
is that one
restrictions.
is? That one is?
Correct, up to 25 kilograms. And then there are, there's advanced licenses as well. So there's restrictions still with a basic license. You know, for example, you can't fly over people. So there's still restrictions, but it's through Transport Canada that those licenses are issued.
So when do you think you'll be able to apply chemical with them?
That'll
on
that'll all depend on the herbicide registration. It's nothing to do with the licenses. It's
No.
strictly to do with the registration of those herbicides. So none of them are have that on label at this time. So that'll be hopefully something that comes down the line in the future.
Like, what are you talking, a year, 5 years?
Oh, no way to guess. It's federally regulated, so.
So through PMRA, and there's research being submitted, so yeah, it's gonna take what it takes with them.
Seems odd when you can spray with an airplane.
Yes,
And you can't spray
absolutely.
with this,
Yeah,
which is a little bit more targeted, I think, than the aircraft, but whatever.
yeah. And there's speculation that it may require a different license. Like an
Yeah.
applicator, not a ground one, you may require, but all of that's totally up in the air. It has not been decided.
Okay, thank you.
Okay, anybody else have any more questions, comments? Get a motion to approve the report, please?
I will.
Thanks, Richard. All in favor? Opposed, of any? Carried. Okay, herbicide purchase.
Yeah, so you'll see there, we did have 3 complete proposals received, and on the second page, you will see the prices as well as the scores submitted.
Okay, motion.
I'll make the motion to go with option 1.
Okay, thank you. Gravel pit spraying.
Yeah, this, as you
Vote-
see the RFP
Just
here,
vote-
it
call
was
vote on
discussed
that.
at planning, and just bring it forward.
Just
to
a
get-
second here, what?
Got to call the vote.
Oh,
on
sorry.
that.
Sorry.
All in favor? Opposed, carried. I guess I was looking for an agenda here, that's all. Okay, hydromulching. Or no, where am I at here?
Gravel pits.
Gravel pit.
Yeah, gravel pit.
I'm missing my agenda here.
Sorry, James.
That's okay, I'm just short of agenda, that's all, but I'll get one. Okay. Go ahead, Dave.
Yeah, basically, just as per our discussion from planning, brought this forward in RFP if council still wants to proceed with the gravel pit spraying proposal.
Okay. What's your wishes?
I can make that motion.
Okay, thanks, Bruce. Any further discussion? All in favor? Okay, hydromulching.
Okay, as again, as per our discussion, we discussed doing 1.5
Thanks.
miles of hydromulching at the planning meeting. That's part of that project out there. Bringing it forward for council direction so we can go out for RFPs if that's councilors' wishes.
I'll make the motion for option 1.
Excuse me.
Okay. Any further discussion? All in favor? Carried. Okay, thanks, folks.
Thank you.
Public Works. I need my paper or I can't function.
You have your routine, right?
Well. Could be a little more adaptable, but.
Bruce.
I got one of those fire sticks. Oh, keep me standing up. You name it, it's on there.
Morning, gentlemen.
Yeah.
Morning.
Okay. Public Works report in front of you. Any questions or comments?
Reclamation on the lagoon gonna start soon? What?
Yeah, we met with Mike Trimble out there the other day, and we're looking at it, we're making plans here probably next week, hopefully, or within 10 days or so.
Is gravel available at the pits now?
No, we actually, we were looking at the weather last week, we thought there could be a decent storm coming, but that all changed on a dime. So we haven't pulled any of our trucks apart, but that's starting now.
Oh, okay.
It was, they were calling for some accumulations
Yeah.
up to 5 centimeters and stuff like that. So we thought we'd just be on the safe side of things. We're gonna start working trucks now.
But you do have a tractor and a belly dump that you could use if you can use them?
Yeah, we do, yeah.
Okay.
Haven't, from that side of things, the operators haven't been phoning for requests, not like I've seen in the previous years. So the requests have been really quiet off the start, which is good. That means everything's looking in pretty decent shape. There's not,
Yeah.
obviously not a lot of soft spots and there's no ruts happening, so, but it's gonna come. I'm asking the guys to get their maps going and we'll
Well,
start,
I think
program.
another thing this year is there was no snow, so there was not a lot of plowing and gravel still on the road.
It really saves on the road. It
Yep.
really does. We saw that last year. We're seeing it this spring already, so.
Okay, anybody got any other questions? Motion to approve, please.
I can do that.
Thanks, Robin. Any further discussion? All in favor? Carried. Okay, safety.
Good morning, everyone.
Morning.
Yeah, a little bit of a busy week last week. I was out for the count the week prior to, just playing a little bit of catch up here. Getting ready for opening season, May 1st. Got the guys on the grounds, they're prepping golf course, changing out valves. Yeah, we're just going forward with everything.
So Riverdale is open on May 1st.
May 1st, yes.
Course too?
We're hoping so. Yeah, I don't see any anything that'll hold us up. I think we'll be open.
Not the pickleball.
Pickleball course probably will not be opened on May 1st. We are still waiting for our power tiles to get down on the ground, and then we have our chain link fence. We're hoping within the next week or so we'll get Power Court or Sports Court Alberta to come in and do the power tiles, and then I am meeting with Infinity Fence this week to go over the chain link fence just to make sure that we're still on the same page and within the first week of May, second week of May.
Are we weaving that plastic into the chain link?
We can. You're thinking maybe
Well, we did
with the
that.
sound and stuff like that would do?
Sound, yeah.
Yeah, we could definitely look into that. That'll be something that I'm going to have to do on top of everything else that we have.
It wasn't part of the
It was not part of the chain link quote, no. But you and I can talk. We can talk about that. We can, when the guys are on site this week, I can ask and see if that's something that that they're willing to move forward with on it. We can find out all the information we need on that.
Okay, yeah, sounds good.
Arm Lake should be opening in time.
Arm Lake will be open in
Completed
time. Actually, the Arm Lake management team is currently there setting up shelves and getting shop ready for opening day. They've already been hounded with phone calls, bookings. They're on par for May 1st as well.
Perfect.
So the camp house is done? The building? All the insurance?
The clubhouse, yes, yes, sorry.
Yeah, I couldn't think of the word.
Camp house, I was curious. No, all of the insurance work inside the clubhouse has been completed. There's a couple of items we're going to do in-house. There's a little bit of siding on the, I believe it's the east side. We're going to remove a piece and put a new piece on. Other than that, we're good to go. Yeah, yeah.
Okay, anything else? Got a motion to approve it, please?
So moved.
Okay, thank you, Mike. Any further discussion? All in favor? Opposed, carried. Okay, an RFT for a scraper?
Okay, so I have in front of you here the request for direction to proceed with ordering the scrapers for delivery in April of 2025.
Okay. Oscar moved that we go ahead. Any further discussion? All in favor? Opposed, carried. Oiling.
Okay, so as we discussed last week at the planning meeting,
Yeah.
we had the projects up on the map there, and I've had the attached map to this document.
Okay.
It's verbatim for what we discussed last week.
Okay, motion to approve.
I can do
Okay,
that.
thanks, Bruce. All in favor? Opposed, carried. Bridge inspections?
Yeah, I'd like to get moving on the bridge inspection. So here are the 11 bridges that we'll be inspecting this year as part of the program.
Okay, motion to approve, that's what you so wish.
We'll go with option one.
Option one, okay, thanks.
Do we have to inspect the ones down by Watson's and Gibbs if we're putting them on to replace? I don't think the bridge inspections, according to the minister, matters when they're 1955 bridges and you can't take 6-wheel tractors across here.
Yeah.
They're not on there.
Well, they're not on the list. We did inspect those last year, though, as part of the program. So they're every 5 years. So they were inspected last year, so they're
But
good
they're not for this year.
for 4
So
more
it's
years.
just a list that you've
Yeah.
got in front of us.
This is just this year's list,
Okay.
yeah.
So who does that? Who's doing the inspection?
I'm subcontracting through Roja Engineering this year.
So the engineers are looking at, well, it says here,
Yeah.
the MD and contractor, so.
Yeah, that's what
I'll make-
I'm contracting.
That's
through
what he made,
Roja,
Richard
yeah.
made.
Yeah.
Okay.
Okay, we have a motion from Richard. Any further discussion? All in favor? Carried. Okay, road construction map.
Okay, so as discussed last week in the planning meeting, we had a discussion to add this to road construction going forward.
Okay,
I'll make that motion.
okay, thanks, Mike. Any further discussion?
So what number will it be?
That'll be determined in the future. So,
Number 2.
okay.
Number 2.
No.
I like it, Richie. That's a hell of an
That's
idea.
right. I don't know what you two got to this morning, but it's nice.
But
to-
number 2 is going to be number 6, and number 3 is going to be number 1. I don't know.
I think we'll.
With
we'll
more
just-
discussion,
We'll
we'll figure that
we'll
out.
number them later. Let's just get it on the map for now.
We need to get it done.
Okay, all in favor? Opposed? Carried. Okay, Dr. Falkins has sent a letter. Oscar, maybe you want to let us know what you think about this?
Yeah, the home and school gave me the letter, wondering if we could assist them in building the track. And so what I agreed to, in my own mind anyway, was
That's a new one.
sell them the gravel at our cost to deliver, if they so choose to use us, and give them the elimination sand.
Okay.
And I would make a motion to that effect.
Okay, so just so we're clear, we would donate them the 225 yards of sand
Yeah,
and sell them the gravel and trucking at our cost.
yeah.
Okay. Okay, any other thoughts?
Well, would this come directly to the MD, or would this normally go through the rec board and shove in?
No, this would be coming from the
I think the
I
rec
thought it'd
board,
be a rec
the
board
rec
thing.
board ideas.
Well, I can, just for history, just, okay, just for
Yeah, I'm
history, guys.
I'm just curious, yeah.
Yeah, okay, I'll tell you the history. About 8 years ago, we had the same request from the Blessed Sacrament School, Kelly, and we give them a grader to do their work, grader and a packer, and we had the same request 2 years ago, no, more than that, 2019, to do the same thing for the high school, and Bruce made a motion that the MD would supply equipment in kind. So that's been history of what we've done.
Okay.
So in Irma, we do things a bit different up there, because if we can tie it to recreation, we run it through the rec board. And we did that once, I think, Billy, since in the last while, right? We buy the chairs and stuff through the rec.
Yep.
So, but that's what we've done. But the requests that come to the table, we've never sent it back to the rec boards. We've tried to find a way to help in kind. So I think this is fine. I mean, we're not out a bunch. The delivery of the gravel is probably cheaper than a couple of days worth of equipment anyways. And then if they want to buy the gravel and we'll deliver it at our cost, and we've done that before. As other levels of government, I remember Alberta Transportation came and wanted to buy gravel from us, and we sold to them, so this is basically another level of government.
The gravel's considered really more expensive than the sand.
Oh, yeah,
Is that
absolutely.
enough help, though? Like, will they still be able to go forward with
That's,
those?
it's up to them what they do.
Okay.
But I think the motion would be fine if you guys are in favor. All in favor? Opposed? Carried. Okay, anything else, gentlemen? Anything else from council for these fine folks? Okay. Thank you.
See you at the open
You
house.
got nothing, Rick? Rick?
Yeah, I'll see you this afternoon.
Yeah. See you later, 4 o'clock.
Thank you, guys.
Thank you, Robin.
Anytime. It was a pleasure having you here.
I'm not even going to go down that road.
What the hell?
I have no idea. And you don't have to explain to us.
Okay.
Okay, finance. The accounts are in front of you. Any questions or comments on them? Need somebody to approve them then.
I will do that.
Thanks, Robin. 4 point some million. All in favor?
That wasn't my fault.
Opposed, that's carried.
That was Tyson's fault.
I just wanted to see the long face in the corner. Okay, financial statement is there for your perusal. Need a motion to approve it as delivered by administration.
I will.
Thanks, Richard. Any further discussion?
Excuse me.
All in favor? Opposed, remains carried. Okay, monthly status report. Any questions or
Reserves?
comments on it? Not, just information. Okay, next one I have in here.
Did we do the reserves, Bob?
What's that?
Did we do reserves?
They're there for your perusal, yeah.
Okay.
57 million.
Nice try, Bill. You're not a deputy reeve yet.
Okay, National Working Week.
I don't want to be late for one.
When you come back. Okay, National Nursing Week, they're looking for a, declare 12 to 16th. If you're so interested, you just need a motion to declare it.
What do they want?
Just a declaration that we support National Nursing Week from May 6th to May 12th.
I'll do that. I'll make that motion.
Okay, thanks, Don.
And we
What's that,
support it.
Bruce?
You're going to handle that one, are you?
Yeah, just- okay, all in favor of Billy's motion? Opposed of any? Carried. Okay, you got your contacts, your member bulletins. And just to check, I gotta take a look here. Okay, Oscar, you had some comments about the budget.
Yeah,
Okay,
I'm trying to figure out how the windows and roof got added into the budget without coming to council or pre-talk about it at least. It was already initiated in it. It was never, it's not like we questioned it when it came to the table, but it should have been brought to us prior to
including it in the budget.
including it in the budget.
Well, that's where we thought we'd have the discussion. We had the report available. If
Well,
council
the
wants.
report is available, it's fine, Kelly, but it came out to us in the budget,
In planning.
pre-approved.
Well, it wasn't, it was just a planning
But it
item.
was still, you know what I'm saying?
Yeah.
So I
if-
guess down to the question, would you rather it come as not in the budget till it's discussed and
So it was
approved?
discussed and we.
Then we add it in, instead of coming in before, but add it later, I guess.
Well, we could take it out of the budget and present it at the next council meeting if you want. It's whatever council wants to do.
Well, I
We've
think-
got a report, we could put it out, it's 160 pages.
Yeah.
We could send it out prior and give you a Reader's Digest version to go over it. It's not something that has to be done this year, it's something to be within the next reasonable amount of time to be proactive.
Once you've done your research and it brings the council, we agree to it, or if there's a grant available for 500,000 to replace the windows, or are we gonna change some of the structure so we don't have this amount of window? I don't know, because it was never talked about. I mean, you come in for 500, we just did the roof, and all of a sudden the roof's an issue again.
Not here.
200,000.
Not the roof here.
Yeah,
Yeah,
they were.
but it's a rec.
That's the rec roof.
Yeah, it's
Correct,
the
it's a
ASP
different
shop
shop.
roof that has
Oh,
to be
different shop.
done. Yeah. That roof hasn't been done since I've been here,
Right.
so
But I
it
mean,
it needs to be looked at.
We still should have talked about it.
So still bring it to planning, but don't have it in the budget at that stage?
That's right.
Well, I guess the issue, I understand where maybe he's coming from, you can tell me if I'm wrong. Sometimes it's easier to add things to budget than it is to take it out. If you get a budget that's presented that shows a surplus, which we had, we started out, right? So when you look at it it's easy to leave stuff in there. Well, we already got a surplus, right? So if you bring it and then you add it, I don't know, I guess it's just a different way of looking at it.
Well, I
And
think
then-
what
and then you would-
Oscar's,
what-
yeah, he's, I can see where he's saying, it was already in the planning for 500, And the planning doesn't mean to put it in the budget, it's a discussion.
Yeah.
Because somebody asked me afterwards, and it could be an option too, what about putting a pony wall through there and using the pony wall and just replacing the top part of the windows? There's no discussion on that.
Yeah.
And that's what we should have at planning rather than just putting
Yeah.
the 500,000 in
Yeah.
the budget.
And I know that when the budget is presented, and Tyson, you can help me out here, we present the budget first, so we've got an idea where we are, right? But I mean, is it any harder for you to leave it out and add it in as the planning meeting goes along like we did with the rest of the stuff? Does it make any difference to you how you do it?
No, it doesn't make a difference.
Okay, so,
Okay, so it sounds like further discussion is at least probably a good prudent thing to do. So what we could do is bring it to the next meeting and have a discussion.
Well-
Present the report and do a, possibly even have a special meeting to discuss it. I don't know what.
well, I think we've got an opportunity, if, like, I agree, like, there's probably some discussion we could have of maybe changing.
And
other than just
options.
window. Yeah, maybe there's an opportunity to have a discussion, doing things a little different way, maybe.
I can see the
Did the track hole make the budget?
so it doesn't wreck it, but it's still.
Did it make the budget?
Yeah, so we could probably bring it up to maybe the next MPC when we're all.
No, it wasn't in there, so.
Still be a
it
special
wasn't-
That would probably
in there.
be a
It'd be more
good
suitable.
venue.
They were added.
Okay,
opposed
can-
to
is that okay with everybody? Do we have that?
Yep.
Because I think there is a fair amount, like, it's a 160-page report, right? But we still need to do the due diligence and make sure that we understand what we're approving, and 500,000 is a lot of money.
The track was not in the budget, is it?
What's that?
The track was not in the budget, is it?
Yes, it was added, it came in after, and it was,
There was no discussion.
yes, there was.
Where's the report on how often we need one brought in?
Robin, we had the discussion on adding it. We made them, in fact, we added that on when we did our planning meeting.
This is the same thing, because it was not discussed about how often where's the report on how many times they called for a track hole and it wasn't available? That wasn't discussed.
Yeah, you're right. But we
So
did
this
have,
is the same thing.
yeah.
It was added to the budget without any discussion for it's a similar thing.
Yeah, well, you can,
But you could have discussed it, Robin, if you wanted it.
Well, I asked.
If you didn't agree with it.
I called Kelly and asked where the report was that council asked for. We asked in one of the meetings for a report on how often that thing would be required, how many times you called and one wasn't available locally, and we didn't get that report. It just went in the budget. So I think it's the same thing. It should be taken out till we discuss it.
okay.
No, but it was put in because we asked it to be put in, so you can't take it out. We asked, somebody made the motion, I'm not sure who made the motion, to put that in the budget.
And you're saying the windows didn't get a motion?
No,
It
they
was-
didn't. They were just in the budget prior to the
Yeah.
motion. That's what we're saying. They were in the budget prior to the motion. We want it taken out. We want that taken out and then have a discussion, say, yeah, okay, we're gonna spend $500,000. Then add it in. I mean, it kinda gives you a false reading on the budget if Tyson's got it in there. And we don't know what's in there. I didn't know what's in
Well,
there.
to me, what happens is, and we have a lot of carryovers lots of times, the budget's very seldom ever used. It's unbalanced, and to throw $700,000 in at the last minute, it looks, when I'm doing the math in my head, it looks like they're holding 700,000, because some of them projects cannot be done this year. So why not do your homework and bring them when you've got availability to the stuff? You're not gonna get all these windows changed in 1 year anyway.
Yeah, I don't.
Why
I
not?
don't-
The availability behind it, so it gets carried into another year, which leaves us with a surplus of roughly 700,000 on that particular issue alone. If we go back through it, we probably have another 1.25 million in surplus in other accounts that we know we're not gonna use. So we're looking at almost $2.25 million still in that budget that ain't being used. That's what I'm looking at when I go through it.
Yeah, but I think on that side though, we set the budget, and you're right, it may not be all allocated
Right.
in that year. And things change, right? And but I still think that part of it I'm okay with. Because
You gotta
there's
have-
unforeseen things that are, I mean, if everything happened 100% the way it should happen, we would allocate that budget, right?
That's right.
But there's things that are beyond our control that we budget to spend, that we don't spend, so, I mean, that's, but we do need to budget, but.
Overrun in there anyway, because take the lagoon, how much did that cost us extra that wasn't in the budget?
Yeah, so-
I mean, to have 10% overriding your budget, that's fine.
But,
So with the windows, just to be clear, are we looking at changing the structure of the building to eliminate some of the overhead of the windows, or what?
We don't know, we have another discussion on it.
Oh, you're right, we haven't, but at the end of the day, they did ask for a capital item to be replaced.
We didn't ask for that, they had it in the budget already.
No, but they also have the report to back it up, right? So that's what I'm asking, how broad do we want this? Do we want to start looking at replacing structure, and maybe we need a consultant or engineer to tell us our best,
Oh, definitely. I'm on board with a consulting firm.
well, I think for the let's focus on the windows for a second. We can have the discussion when we have it at MPCB more, we'll have more information then, and we can figure out which direction we want to go. And Robin, you are right, we did ask for a report on the track hole, and we never did see that, so do you still want to see that report?
Absolutely.
Okay, so then, can you get Preston and Mike to get that report? Because we did ask for that, I think it was a year ago, that we'd asked for the usage of one before.
it was at planning last year.
Is that what, I know. So can you get a hold of, we need that, put the numbers together for us.
I will.
Okay, thank you.
Kelly, one other question.
Is that for what we used at Traco, or what you could have used?
What we could have used it.
And how often you called a local guy and it wasn't available? Because that was the pretenses behind needing one of our own, is that you call and they don't come. And I don't think, for the amount of them that are parked around.
Well, we had 11 sitting in Sheldon, but they weren't on the bid list.
Yeah, that's part of the trouble.
Part of the problem was the bid list, Rob. We have lots, but only a few of them committed to put a bid in on it.
Yeah, on the roster, I think there was only 2 or 3 that actually.
Yes.
But for
had a
some
track
reason,
hole.
everybody else can subcontract, so that's not true.
What
Or,
do
I
you-
mean, it's not that they're not available, they subcontract each other.
But they
Well,
ain't
if they want-
subcontracting.
But they've got to be,
it.
they've got to be on our, but
Yeah.
they've got to be on our, they've got to be in our list. We just can't go hire a contractor.
No, I understand that,
But-
but your initial contractor can subcontract to people.
That's not up to us.
So,
If they're not, if they don't have a hole available, we don't tell them to go find us a hole. We phone them and they have a hole, they say no, we go to the next on the list. Do you have a hole? We say no.
He's phoning is $50 or $100 more an hour. Or is he gonna pay them that, and we only pay for his contracting rates? That's where the problem comes in, because these guys won't drop their rates to match what he bid it. And I asked Calvin, why didn't you bid on it? He said, I bid on it for how many years, and I was never ever called, so he dropped it. He didn't even bother putting a bid in. So in one aspect, you're right. If he had never phoned,
Yeah, they're not going to come.
you're not gonna come.
Okay,
He has 11 of them sitting there.
Yeah.
Okay,
just
so-
where-
yes,
Sorry.
go ahead. No, go
Just
ahead.
Where did we get that $500,000 figure? Was it an actual quote or just an estimate? Or how did we get that?
We hired a consultant to review the condition of the buildings that we have, right? And they gave us that estimate as we
Okay.
went through the buildings. So
Okay.
that's an estimate for the replacement of the buildings. That was the intention, or sorry, the windows, replacement of the windows as are. So 500,000, I mean, that's a bit of a liberal estimate. I think it's probably going to come in less than that, but it's a number to work with, give us an idea.
So the other part that we talked about was.
So when did we approve it?
just a minute.
Oscar.
Just for Oscar, just a second. Okay, go ahead, Bruce.
So the other part of the deal was for the 700,000 was the roof. on
Roof, the
shop.
service board, yeah.
So are
That's
we
right.
going ahead with that?
No, apparently, no, we're going to put a stop on that. We're going to take it out of the budget as of now, based
Why?
on, that seems
We-
to be the
No,
direction
Those
of
here,
council.
But the other part of the deal was the roof.
just,
And the roof is, I thought,
just a minute.
very important.
Just a minute. Neil, when we, maybe Tyson asked this, when we bounced our preliminary budget at the end of the day, we took 2 things out.
So,
One the roof?
sorry, so at this time, the MD of Wainwright is operating under the interim budget that was passed.
Yeah.
And then the next budget meeting is April 30th.
Yeah.
And that's where it would be finalized. But at this time, the budget when planning ended, there was, I believe, it was not complete because Tyson, you can correct me if I'm wrong, but we were still waiting for finalized assessments. And what will happen is on the 30th, Tyson will outline a list of potential changes that occurred over the 2 days. So what we can do as a potential change is we can just put those capital items on the list. We'll present it to council with just the roof listed there and then the windows listed there. Council will be able to debate the merit of those projects and question and go
Then
back
go
and
forward.
forth and then make the decision if they're in or out. Does that sound kind of good?
Yeah, but I know that when, at the end of the meeting, we took some stuff, because we were over, when we started the meeting, we had a $675,000 surplus, correct? And at the end of the meeting, we took 2 things out, and somebody said, well, we're a couple of $100 over, and I thought one was the roof. I don't know what we took out. We took out 2 things, though.
It was, the 2 things that we took out was brought forward by Neil to Tyson.
Yeah, like what, so what, I don't know what you eliminated off
And that was
that
the
day.
windows and the roof.
There's still some adjustments to be made
Okay.
between now and budget.
Okay, okay, Oscar, you had another comment you want to make?
I forgot.
Oh, sorry, I just
You
wanted.
asked about the consultant, that was approved by council.
Okay, so we got a direction going ahead then? Everybody clear as they can be? Okay, a fire ban is the next thing I have on my list. Okay, as we know, it's a bit on the dry side. Do we want to? Oh, I guess we'll go back to that. See here, are they here? Okay, let's go back to Mr. McDonald.
I got to go to Washington. Do we do that?
Can you shut your mic off? I did.
So Tyson, now that we've added this road onto the, doesn't change anything? Cost is still the same? Oh, I see, okay.
Hi, James. He's coming.
Oh, he's coming. He's looking for you.
He's always looking for me.
So like in the North Country, good.
Well, up there in the banana belt, it's pretty nice. Go ahead.
Do you want me to just get rolling, or
He's just coming.
I'll just wait for him? Sure. Yeah, it's pretty good up there. It's a nice drive. It's getting, the weather's going cold on us again here, though.
Yeah,
Somebody order that?
it could be wet, be better.
Yeah, it's allowed to rain between midnight and 6 a.m. Every
I
day.
agree.
That's,
It would be good.
yeah. Yeah, it would be.
Okay, well, Oscar will be here in a few minutes, so let's get
Sure.
you
No worries.
started. I imagine it's a busy day, so
You bet. Here he comes now.
there you come.
Councilor Buck, good to see you. Should I just give this to you now?
You bet.
Okay. That's our new service catalog. So if you'd like me to just get started, I can.
Yep, absolutely.
You have people
I think
online?
everybody
Yeah.
knows James,
think
right,
so.
from Northern Lights, or do you want introduction?
I'm Bill Lawson, I'm a counselor in Division 6.
Good to meet you.
He's been waiting all day to say
Yeah,
that.
I have waited a while there, and I'll ask you at the end of the meeting if you remember what division I'm in. You better remember that.
It's on your plaque, so I better. be-
Yeah, that's what I thought too.
If I can't read,
but
we're in trouble.
That's what I thought too, but
Robin
anyways.
Layton.
Oscar. Here's one.
Bob.
Mike Wildemore.
Bruce.
So I'm the only person that gives you a division. I don't know, you guys are ganging up on me.
I do sorry, James. Okay, go ahead, James, give us
Thank you.
your
Well, I'm
report.
James
Thanks.
McDonald. You all know me. This is my 3rd year, I think, coming.
Yeah.
We're on to service catalog number 3, and hopefully Councillor Buck will share that service catalog with you as things we're doing. But I did provide a value statement, and for those that might be online or your residents, just know that we're one of 7 regional library systems in the province. We have 61 participating municipalities now, which is exciting. We welcomed, last year in 2023, we welcomed the town of Legal, the town of village of Glendon, and Elizabeth Métis Settlement has also joined us, which is very exciting. We're glad to have them on board. As a cooperative, we provide access that your libraries could not provide on their own to materials. So we are members of TRAC, which is a consortium of 4 regional library systems. Gives access to your residents to more than 3.5 million library items, 3 million library items, physical library items, but also electronic resources, including a vast collection of ebooks and e-audio books, but also newspapers, digital newspapers. So if you're getting things like the Edmonton Journal or things like that, those are available online the day they come out through the library. Also homework help like Solaro homework help, which is mapped to the K-12 curriculum in Alberta. So people can do pre and post tests, things like that. So family history, research, all sorts of things, which is really exciting. So I'm going to focus, as I do, on our circulation because it's easy. The numbers are there, and it gives you an understanding of kind of what we do. Each of your libraries, your 4 libraries that serve Wainwright Municipal District's residents, Chauvin, Edgerton, Irma, and Wainwright. Each of those libraries receive at least 1 van run every week, delivering books to them. We delivered over, just about 800,000 books throughout the northeast of Alberta, physical books, and about 150,000 electronic ebooks and audiobooks were downloaded and used by the residents here in northeast Alberta. And you guys took a good share of that. The municipal district, 78,000 physical items were circulated to your residents in 2023. 6,100 ebooks and 4,600, almost 4,700 e-audio books were distributed. That's a value. If your residents had just paid for that, they just said, you know what, forget it, we'll just go to Amazon or Chapters or Indigo or whatever and just buy them, they would have spent $2.7 million, almost $2.8 million to purchase those items. Now, let's be honest, they probably just wouldn't purchase the items. So what does that mean? It means families without books in the home for the kids reading. It means people in long-term care facilities without audiobooks listened to or large print books. It means a great diminishment in the quality of life for your residents without library services like this. To be a member of Northern Lights, in 2023, it cost $48,284 was the levy that you paid. Out of that, $9,630, $2.15 per person is set aside as a book allotment. So it doesn't go to our operating, doesn't put gas in the car or the vans or tires or put a roof over the headquarters. It goes to the local libraries for them to purchase books and materials, so to continue to build a strong collection. And because you're members of Northern Lights, you qualify for a provincial operating grant called the Rural Services Grant. That's nearly $25,000. Again, that's split up. It doesn't go to us. It gets sent out to your local libraries for local programming. In reality, for every dollar that you're investing in Northern Lights, just based on these numbers, not all the other things we do, you're getting a return of investment of $71 for every dollar invested. I think pretty awesome. You do have 1,030 active library cards out there, keeping in mind that a lot of families will have 1 card for the whole family, so you can multiply that number a little bit. That's a pretty good penetration of your residents. I'm not sure of many other facilities, rec centers and the like that get that much use, so you're doing quite well.
What was that number again?
1,030 active cards out there. Now, you might hear different numbers from some of your local libraries. We tend to be pretty hard on them. They like to say, well, there's more. We just look at the active cards in use, and we only go back a few months before the year if something was expired. So we're pretty stern on making sure it's active cards being used that we're reporting on.
What's an active card?
So an active card is a card that is used.
I know.
So
when?
like
In the year?
in the year, yeah, it had to
In the
be
year that you-
in that 2023 year. That card had to have been used for something, whether it's to log into the Wi-Fi or to check out a book or whatever. It has to be used, not just I got a card and then I never used it, right? So,
One question I have for you. I don't
Sure.
know if you want to stop?
oh, you can,
Yeah?
you can
Yeah, I
ask questions all along
Yeah.
the way, and
I
I'm
wanna-
pretty much done.
I want to know how you reached the number $71 return on investment per person.
Yeah,
That's
yeah,
it.
per dollar.
Yeah, I'm just wondering
So-
how you arrived at that figure.
Yeah, there's a QR code that will take you to how we calculate all these stats, but basically, you paid $48,000. We took that 48, so you can do some simple math. $2,794,000 was the value returned. We just did a division there. And so reality is that for every, so we don't include the rural services grant in there. I think we take the book allotment out because that's money going elsewhere. And then we just divide 2.7 by 48,000. And that comes out to your $71 per dollar invested. Again, that's not including all of the other things we do, the Wi-Fi services, the internet, the consulting services, none of that
Is
stuff.
the government grant in there?
The government grant is not in there.
And
Taken
then
out.
what was the government grant this year?
$24,832.
Is that up or down? That's up, is it not?
What do you mean?
The provincial grant?
The provincial grant. Oh, and I should say thank you for your support in
Yeah.
helping with provincial grant. It has gone up slightly. We went from $4.70 per person to $4.75 per person. So that's helpful. Less helpful for the system when you think 5 cents than for your local libraries. The local libraries got a much more significant increase. So the base funding into your local library for every one of those libraries gets at least $9,000 as a base grant, and then they get $5.60 per person, up from $5.55. So the base grant used to be about $6,000, so that's a decent increase. But it is the first increase they've had since 2015.
Did we transition to the 2019 census numbers, or
We
were
did.
we 16 still?
No, we
19.
did. So
Okay.
the two things that happened in 2023 around that is, one is transferring to the 2019 municipal population numbers, and the two is the slight increase, the 5-cent increase per person.
So what is, do you have that number of the population for all
Yeah,
your?
your population, 2019 population is 4,479.
No, but I mean for your whole system.
For the whole system, population is 177,000 some.
Okay, thank you.
Yeah, no problem.
I have a question.
Sure.
We have Frog Lake First Nation.
Mm-hmm. It is, yep.
We have a Frog Lake Lake,
A fishing lake, yep.
and we got the Elizabeth.
That's right.
How many tax dollars do you get from them?
That's a good question. So how it works right now, we get what's called an on-reserve, on-settlement grant. Essentially, we get the $475 per person for the population of the Indigenous communities in the area. There are 13,102, I think, people on reserve and on settlement. So you get 13,102 times $4.75 comes out to just under $70,000 to serve them.
Is
Yeah.
that given to you by the
Provincial government.
by the settlements?
No. So what happens with the settlements right now, as they get rolling, so Frog Lake is into its third year of membership with us. Through provincial grant funding, we're covering their levy costs. Next year, 2025, they'll pay their levy cost. So,
We've been getting one out of that budget for the last 3 years.
out of provincial grant monies, they've been essentially given, they don't have to pay their levy just to get them up and running and started. We do that not generally 3 years, but for all of our libraries, there's usually a provincial establishment grant, things like that, to get things rolling. It takes some time to get a library off the ground. So ultimately, it is in the system's best interest to, at least in terms of provincial dollars, to bring all of the Indigenous communities into membership with Northern Lights, and we're working hard on that.
I'm not
Yeah.
trying to dispute it. This should be 100% funded, not taken out of our general fund,
It is 100% funded by the provincial operating grant, yep.
which you're not doing right now.
No, we are.
Just how long was did you pay for Frog Lake?
Oh, their levy payments? Yeah. No, well, we paid them through a provincial operating grant that requires us to use it on Indigenous services. So it's not coming out of our general operating money. Yeah, yeah, yeah. So there's specific money set aside for
Okay.
that. Yeah.
Okay.
Any other questions?
Other questions or comments? Good report.
I love coming to this council. You guys give me good, hard questions. And,
That's
no, it's good. I mean, not hard questions, but you're thoughtful. So thank you. I appreciate that.
Okay, does anybody have anything else?
I think just a shout out to the support that our library gets. I know Jody feels that the programming's amazing, and what you guys did through COVID, helping with, proctoring exams, and how AISH had to use the public library when manpower was down. I had no idea what a library can do until you sit on the board and see how busy it is there, and the programming they provide for families and stuff like that. So I think it's a great job.
Thank you. Appreciate it.
Okay, anything else anybody has? Okay, well, thanks, James, we appreciate it, and glad you traveled down to see us. We like the face-to-face meetings, so it's good to see you, and hope you have safe travels back.
Thanks.
Okay, thanks a lot.
We'll be up
Good to see some of the changes being made.
Thanks.
They ain't going unnoticed, let's put it that way.
I praise.
Okay, let's do fire, and then we can maybe take a break. Okay, fire bans. What do you guys think? One or two? What's your wishes?
I got to get clarity again. I don't know if we need James. What is one? Does that mean you can't have any fires at Riverdale? Is that like campfires and what is that?
I think I get James, but I think it means no fires.
Yeah, no fires that you can't have a.
No fire.
No barbecue.
Is that what we want? I don't know.
Yeah, that's what I want.
That's what you want?
So you don't want fires in pits right now either?
Well, they're the ones that
No,
cause
not
most of the
wind
trouble.
and
They should have them burnt off already, Mike.
Fire pits.
Fire
that.
pits,
Lots of-
fire pits, like backyard fire pits.
Recreation.
Well, that's cooking bacon.
Yeah,
Cooking a hot dog over and
yeah,
over fire.
but that's we'll get changed, but I think that's what it means.
Anything you need.
Shit, and otherwise, if it's a propane pit, it's allowed, but if it's a open fire log pit, it wasn't allowed under number 1.
Okay.
That's what, but Jamie can, he's got his book with him. Got a book.
Well, we got to be technologically correct here.
Okay, Jamie, they would like to have the differences between a full ban for the entirety of the MD or a restriction. I guess it's the difference between restriction and full ban.
Okay, a full ban is everything.
No fire pits, nothing.
No nothing, no Charkill barbecues.
What about propane barbecues?
I think that's fine, I think.
Yeah, okay.
Yeah. Like, that's a full ban. That's
Yep.
everything.
Yep.
When you use the terminology, at least in the past, a fire ban,
Yeah,
that's allows your contained fire pits and your charcoal barbecues. That's a fire ban.
yes.
Full ban is everything.
Okay, so a restriction is you can allow your fire pits and your charcoal pits and your propane pits, or not?
On the
No.
restriction.
Oh, I guess that's within your full ban, you can have restrictions. If you just have a straight restriction, you restrict certain things. You may say.
Oh, okay.
It's all over the board. You may say, instead of putting a ban on, that you're not going to issue fire permits. That's probably something that could be included in a restriction.
Yeah.
Your awareness thing is an advisory.
okay.
There's advisory, restriction,
So
and
if you-
fire ban.
so
And
if you
it's
put it-
not cut, and it's
So
not.
if you put it in restrictions, you have a list of restrictions that you want, but if it's a full ban, it's no fires at all. Would that simplify it?
A fire ban would have within it
Yeah,
like potential restrictions, like saying it doesn't, you'd clarify.
Yeah.
Like you would say that excluded are, you don't need, sorry, you can have your burning,
like your pit.
your pit.
Yeah.
So that's a type of restriction or guidance in there.
Yeah, okay.
Like, so what we've done in the past, we've done full ban, that's everything. We've done a ban, just a plain fire ban, which allows your fire pits, contained fire pits.
Yeah.
And your charcoal.
Yeah.
We've also, at one time, I think, and Kelly, correct me if I'm wrong, we may have made a restriction saying that we're just not issuing fire permits in the municipality as a toll
Or
in
by
certain.
division, yeah, I remember
By
we-
fire area, not division.
By fire.
Fire
Yeah, I
area.
remember we did that for what, couple of years, right?
Yeah, so that's, it's not 100% cut. There's
Yeah.
little details in each that may overlap, because
So-
everybody does it slightly different.
So there's like really three. There's either a full ban, a fire ban, or a fire ban with or a fire
Or a restriction, according to the site, restriction or advisory.
Yeah. Okay.
And that's what's on the fire ban site right now. You have those two.
All we would need is a permit restriction, no more permits.
Okay, okay, that's an option. Do you want to take away the fire pits?
I don't. I don't.
Does it
think-
affect our recreational stuff this summer?
Yes, you bet.
Yes, it affects your parks
Yeah,
in a
they're
big
not
way.
gonna be happy maybe.
I think that's where probably the biggest,
Yeah.
the biggest concern would be the fire pits at the parks, right? Bill? And
Yeah.
like your Fabian
Yeah.
and one out east and.
I mean, if it stays dry for a while, we can change it, but if it stays dry for a while, I mean, then you go into May, the long weekend in May, I mean, it's cool generally.
And if the
People
problem-
like to have a fire pit.
And if the province initiates a full ban, then we go underneath with their jurisdiction. They control it.
If they do a
Yeah.
full provincial one, they
Yeah.
may have bans in the,
They do have some
The other
stuff up
areas
north up
currently?
there now, but I remember one year they put a full ban on the whole province, and we had
Yeah.
no control. There was no fires.
Was that-
100%.
Was that fire at Fabian in a pit? Do you know yet?
There's nothing confirmed about it. I
Okay.
don't have that information.
I wasn't sure if it was in a pit and got away on somebody.
So what's your wishes then? Do we want to have, what,
I'd like to see no more permits. I don't want to, so restrictions, I guess.
okay, is that agreeable?
No more fire permits, but I'm all right with the briquettes and the backyard barbecues and our campsites being
So we,
in a contained, gotta be in a contained.
yeah.
I support Bill on that.
So right now, we just have a motion to not issue any more fire permits. Is that what I'm hearing?
Yeah.
What
Since you guys are.
James wants, James has a comment.
Yeah, James?
just for clarification, if you do that, please clarify in your motion whether the other fire permits are canceled. When you put on a ban, that automatically happens.
Oh, okay.
When all fire permit, existing
Yeah.
fire permits, we phone them all and they're void. When you do a restriction, you have to identify and say it exactly that, if that's
Yeah.
what you want.
I think that's what you'd want.
That's what I want.
Yeah.
Yeah.
Yeah, that sounds.
So are we all, somebody want to make a motion that we all
make
want? Who did?
We'll let Mr. Buck make the motion.
Oh, geez, you guys are very cordial this morning. I kind of like that.
I thought Bill made that one.
No, he hadn't.
He had his hand
Really
up,
doesn't
that
matter.
mean anything.
Well, somebody needs to make a motion, put your name.
I'll make a motion that we restrict all permits from this point on, and we contact the ones with them and cancel them.
That sounds good, James.
Okay,
Okay.
all in favor? Opposed, if any? It is carried. Okay, let's have a coffee break while we wait for our next appointment. Linda, how are you doing this morning?
I'm great.
We're back
Better
on,
since I
Stephen?
see all
Call
of
meeting
you.
back to order? Okay, good. So, anyways, folks, we have Linda Farnham with them with STARS. I think you know everybody around the table. You've come every year. So we would like to welcome you and turn it over to you, and you can take us through your report.
Okay. Do I need to do anything? Oh, no,
Nope,
it's on.
you're good.
Okay. Well, it's great to see all of you again. I'm very pleased to continue to bring you an annual update. And I want to thank you very much for continuing to be a partner with STARS for many, many years now, decades. So we can celebrate that. As you can see, I think I pointed out last time, we have a little bit different logo there. We did a little bit of a different rebrand with the latest in technology, a brand new fleet. Like, STARS is not who we were when in the beginning in 1985. Next year, we are celebrating 40 years of serving Albertans. 40 years, and always remaining as a charitable entity so that we can be there for the next patient who needs us at no cost to them. So that's an important factor, and you have been a part of that for many years. So our new focus is, we've always been about saving lives, but we're taking that one step further in how we can better assist a lot of the rural communities that we serve. So focusing on critical care anywhere. Next slide, please. So of course, as an update on our financial side, previously we had 10-year affiliation agreement in place with Alberta Health Services for 20% government funding, which expired in 2020. We've been year to year ever since then. In 2022, they gave us a top-up to 50% of operational costs only. So it's block funding of $15 million per year. This does not include our emergency link center costs for our dispatch center for all our bases. It does not include education or training, and it does not include administration costs, so strictly operationally related. So we've been at the $15 million block funding. We received that again last year. We are in very high-level discussions with them right now, hoping to secure another 10-year long-term service agreement at this block funding. So more to come at your next update on how the discussions unfolded and where we actually land. With that, though, this year again, we just finished our lottery a couple of weeks ago. We have a very well-respected lottery across Canada. It's running more than 30 years, usually always netting $10 million. That pays for one base in Alberta. So we are very fortunate that Albertans continue to stand by our side for more than 30 years, and we did hit the mark again, just over $10 million net for this year's lottery. So as we move forward then, once you take into account the lottery funds, it still leaves us $18 million per year that must be fundraised for the 3 bases in Alberta. So that is a part, municipal support that we receive across the province. We're at about $2.2 million right now, collectively for all municipalities across the province, including into northeastern BC. And so with that offsets that $18 million. Then, of course, we have a lot of corporate sector, that are providing annual commitments like yourselves, as well as many long-standing community events. Some been going for more than 30 years. So those will all take into account for the remaining part of the fundraising that we must do every year. Next slide, please. So this is where we're at now with the municipal support across the province and into northeastern BC. Everywhere that you see green is an annual municipal supporter of STARS. So we are very close to uniting the entire province together in a united effort to ensure that everyone has access to a robust health and safety network. Last year, up till now, we have now added 17 more rural and urban municipalities. We just confirmed about a week ago that City of Brooks has come on board now to be our champion and be the very first city in southern Alberta, Grand Prairie in the northern region, and I have many other pending requests out as well as we continue to close the loop and unite the entire province together. So this is a very complicated map here. The red boxes represent our municipal leaders, so those that have now moved to a significant dollar value each year that they've put into their emergency protective services budget. So we are a line item in emergency protective services budget. And they are all represented on the helicopter as well, having given anywhere from starting at $500,000 collectively up to $3 million. So some really long-term supporters. The yellow boxes, including yourselves, now they represent our regional leaders. So number one, all yellow boxes shown are giving at a minimum $2 per capita rate or higher, going up as high as $90 per capita and everything in between. Of those yellow boxes as well, then, they are also representing regional partnerships, meaning that they are building partnerships where their towns or villages that lie within their boundaries are also a supporter along with the county or the municipal district. So, for example, in Wainwright area, the town is supporter as well as the municipal district. So we're building on that. The little stars represent those rural municipalities that have every single town and village within their boundaries are supporters. So we're continuing to really unite the entire province. Next slide, please. So let's have a look at, okay, this is a 5-year overview for the MD of Wainwright on mission statistics blown by stars. You can see we do cover several different areas throughout your county as well. There's a lot of critical interfacility transfers coming from your hospital. Always keeping in mind that the majority of all critical interfacility transfers are generated from an occurrence that has happened in the rural areas. That patient's been taken by ground ambulance to the local hospital. Because it is of a critical nature, then STARS is called to come and get these patients as well, to get them to tertiary care. So this really gives you a solid overview of what's happening throughout your municipal district. And 2 missions already this year as well, so far up to March 31st this year. So on an overall average, throughout the MD of Wainwright, you're seeing about 11 missions per year, so almost 1 a month. Next slide, please. So here's an update to the postal code project. We'll look on the left-hand side first. Once again now, 123 residents that lie within your boundaries have been flown by STARS since 2010. Now, if we just give an update for just last year only, there's been a total of 5 residents flown last year. 3 that possess Wainwright postal code, 1 from Edgerton and 1 from Irma. Now, with that, also keeping in mind, this does include rural residents. We're not able to identify because we cannot use any other patient information in order to know their exact address. We only have the postal code. So it could be a rural route with the postal code or, a street address. So on the right-hand side, though, again, you'll see the little outline of your boundaries in blue, but a lot of red dots outside of that. Accidents and illness do not happen just because you're close to home. There's been a lot of different areas. So in total of these 123 residents flown, 87 residents were picked up within MD of Wainwright boundaries. 36 of these residents were flown from 17 other locations across 2 provinces. So once again, this is a testament to the value of our partnership together. Your residents have access to STARS all across Western Canada from the 4 prairie provinces where we have bases and serve Eastern BC. Next slide, please. So of course, I brought you previous information about our brand new fleet. The fleet is complete now. We have 10 H145s in total. All bases are H145 operational. Last year, we were able to incrementally sell off our previous BK-117 fleet. So we've attributed all of those sale proceeds to the capital campaign. So a more than $150 million capital campaign is completed. All 10 helicopters are paid for as we move forward for generations to come. And of course, we celebrated as well our night vision goggle capability. You know, we're very proud of the fact that we continue to be an innovative leader in the world. We were the very first helicopter EMS program in North America to be able to fly at night more than 20 years ago. Literally tens of thousands of patients' lives have been saved because we've had this capability. Next slide, please. STARS is now much more than just rapid transport. Through our Emergency Link Center, they are integrated with all dispatch centers as well as all resources across the prairie provinces. They utilize precise GIS mapping coordinates in order to help locate a patient, especially at scene calls. We also, now that we have been named the critical care provider for Alberta, that we also dispatch HALO and HERO responses, so for southeastern BC as well as northeastern BC. They receive more than 36,000 emergency requests every year that we help to coordinate on what is the best option for that patient, all of these different areas. And now with our transport physicians being in the Link Center and available 24/7, they now provide medical and critical care guidance and procedural guidance on every single critical call, regardless of the mode of transport. So ground ambulance, rotary wing, and fixed wing, it is our transport physicians that are coordinating where that patient's going to go, what are the needs for this critical patient. So while the patient may be en route to the tertiary care center, but our transport physicians are also in the background coordinating for this patient. So they are scheduling the neurosurgeon, they are scheduling the cardiac cath lab, the mandatory CAT scanner, all these things for a possible stroke patient. So these are happening simultaneously at the same time to save precious time. So once that patient arrives, then they bypass emergency and go directly into trauma surgery, wherever the case may be that is warranted for that patient.
So is your link center at the airport? Is it where your main helicopter building is?
It is with our Calgary base, our head
Oh, it's your
office
Calgary
base.
base.
Yes, it's at the Calgary base.
Okay.
So we are also now, with the latest in technology once again, able to provide virtual care. So this is a great asset, especially for your rural hospitals, in the fact that maybe the helicopter might be out on another mission, and then a call comes in from a hospital and they need guidance. Our transport physicians now can have virtual care and accessibility to your rural medical professionals and be able to provide that guidance or procedural guidance. You know, maybe like we intubate a patient every day. They don't. And so this is another opportunity that we are still able to provide critical care in a different manner to your rural hospital and your
Through
staff.
what process can you do that?
It's called, we've been trialing this for the last year or so with certain hospitals. But previously we did this as well during COVID, like just by FaceTiming with the doctor.
Health
You're
Link.
saying FaceTime.
Health Link.
Well, now it's different. It's a very secure, it's called Good Sam. It's on a secure link through an iPad. We haven't completely, it's not totally in
not right
place
there
yet, but with all the hospitals that we have been trialing it, and we're trying to work with Alberta Health Services as well, that, you know, they would be accepting of this particular program. But the hospitals that have been on the trial, it's pretty amazing. And we're utilizing that more and more.
I have one more question here. Now, when you arrive at a scene, you're at a scene, what kind of radio system do you need to have contact with our departments?
That's a good question, and I know that we have, we are in contact with all the fire departments that we have that. There's a certain radio frequency that they use, or they're able to, connect with the pilots in order to determine through the Emergency Link Center as to which is the best channel in order to
Okay.
utilize.
Some of the departments are thinking about changing their radios so that we have contact with you, but I don't know if that's a need right now.
Do you know what system they're?
AFRAC.
AFRAC?
Yeah, that's a
Okay.
radio system that's government in Alberta that the Fish and Game use
Yes.
and whatnot, and that's one that the departments now want to get or go to. I don't know. So what you're saying.
I'll check on that then,
Okay.
because that sounds familiar.
But
So-
right now, you have the capability to link into every fire department that you're with.
Yes, on whatever system they have, right, through the Link Center. The Link Center is able to help us to be in contact with them on whatever system or radio frequency you're on.
We help the land that helicopter backtrack where there's a hard enough spot to land. That's all the connections are.
Exactly. Okay. So we'll keep going. Next slide, please. So of course, we have the latest in technology. We have brand new fleet. We have wonderful medical equipment. I brought you an overview last time of some of the really nuances of the new medical equipment in the back of the helicopter as well. But it's also very important about the critical expertise in your crew. And we put a lot of effort into training constantly. Our crew members must train mandatory up to 200 hours every year of simulation training as well as textbook training. Through that, we also have clinical educators at each base. So they will recreate and replicate very distinct, complicated cases that maybe, one set of crew members have gone to this scene and it's something that you'll never see again in your lifetime. We don't want those to be the only 2 crew members that experience that. So we'll recreate that and put that, all our crew members through the same paces in order to have that experience and get that expertise for that particular scenario. So we also do in-field training. This is really important that our crews are ready for the most unthinkable. They also must prepare for inclement weather as well as patient vulnerability, and especially in high consequence situations. So for example, one of our crews, this has been just this last winter, fall, I should say fall, that the patient was on the side of a riverbank. So the Emergency Link Center was able to locate an open area right on the riverbank where the helicopter could land. But the patient was on the opposite side where it was completely forested and there was nowhere to land. So it ended up, all of our patient packs and like the cardiac pack and all these are all portable. They put them on their backs, pilots included. The 4 of them forged across the river to the patient, packaged the patient. It took all 4 of them to bring the patient back to the helicopter in order to get that patient off to tertiary care. You never know what they're going to come up against. So they train to the fullest on so many different scenarios. So it's quite impressive when, once a call comes in, that's when they have to determine what's the game plan and what are they going to need to do in order to reach the patient sometimes. We also do chain of survival partners, landing zone training with our chain of survival partners. And so with that now, because there's been so many requests from a lot of our rural fire departments, because they're always acquiring new members and that they haven't had that opportunity for that training. So now we have put it online. So that might be something to pass on as well to your fire department, is that there is a form that they can go on under stars.ca, and it's under the Critical Care Anywhere tab that they can fill out the form and request some online training. Next slide, please. So of course, as a part of the critical care expertise is the International Air Medical Transport Conference, which I brought you information about this before. This is worldwide. It brings together helicopter EMS programs from around the world. to send a team of 2 to represent their organization or their service, and it's a very rigorous competition. They must triage multiple patients in the most inconceivable types of critical situations. They are utilizing the human patient simulators, as you can see, and they are graded on their decision-making, the timing, and of course the patient outcome. The scenario, this late October last year, the scenario for our crew members was the fact that it was a head-on collision. The husband was ejected from the vehicle with a massive head trauma. The mother was in the front seat still pregnant and going into cardiac arrest. And a child had a head trauma as well in the back seat in a car seat. So you have a team of 2 managing these 3 critical patients in different locations. And then at the conference center, the lights went out. And our team had to manage these patients in the dark for almost 2 hours. These are the types of things that they're up against when they're competing. We're very proud of our crew members. We always host our own internal competition to allow only 1 team of 2 to get the honor of representing STARS internationally at this particular competition. Our crews have participated for 21 years straight, and we've been top 3 in the world all 21 years. And we've taken first place 7 times out of those 21 years. We're very proud to bring your residents the highest level of critical care available in Alberta. Next slide, please. So in closing, thank you once again, MD of Wainwright. We thank you for your ongoing pledge and commitment to STARS to help us support life-saving missions. We're averaging 9 to 10 missions every single day. So literally, a life is saved every day. But partnership has made it possible now for almost 40 years. So we thank you again for your current commitment of $10,000 per year through your council term running through next year. I will pre-warn you, I'm going to be asking next year for consideration to move from a 4-year ongoing pledge to a standing motion. We have more than half of all of the municipalities that were on the green map that have moved to a fixed rate like you are at a standing motion, meaning that we are now a line item and we don't get forgotten as there's council changes, there's elections, changes in the CAO that doesn't know that, they have been 30-year supporters of STARS, this type of thing. So we're finding that a lot of our municipalities are also saying that it's ease of process for administration. And so I will be proposing that next year for your consideration. But we do thank you for your ongoing commitment to STARS and helping us to enhance rural health care. Well, on the green map, I think there was maybe 5. The white areas show the ones that are still currently non-supporters, but they all do have a request in front of their councils. So that would rurally, with the exception of Wood Buffalo, as majority, we don't do hardly anything for them, maybe 1 mission a year at most, because we dispatch Hero for them. And then it makes more sense for the patient to be, it's called Newton's Cradle, to be moving the patient to a higher level of care at the same time. So we usually will dispatch Hero, who will take the patient to, say, Conklin or Lac La Biche, and then we might, from Edmonton, meet halfway and get that patient. So that's why they're not included in this, but they are a key aspect. We do really serve in the Halo area because we do a significant amount of missions to Lethbridge Hospital and to Medicine Hat Hospital as well, when those critical patients have been picked up by ground ambulance or Halo, taken to the nearest hospital, and then because it is critical, we are dispatched. For Lethbridge area, that's one of the top 3 hospitals in Alberta that we serve for a lot of their scene call missions that have been taken to that hospital. So with that, that shows you 1, 2, 3, 4, 5, 6. 6 left out of the rural. And then, of course, the yellow ones represent that they are having some towns and villages within that are also joining. So that's probably at least 70%, right?
How much is the ones, where do we fit on the scale? Municipalities, when they say you donate
$10,000 a year you're on a fixed rate. So you're just a little over $2 per capita. Little over $2 per capita.
Are we low on the scale or medium?
With the ones that are all in the yellow boxes. Now that represents that they are at least doing a minimum $2 per capita or higher. So I would say probably about 35 or 40% are somewhere in the $4 and up. And then the range goes as high as $90 per capita. So, you know, we have maybe 6 or 8 that are giving in the kind of $25, $30 per capita range. So quite a few, there's a quite wide variety, but we've always wanted to start at a minimum $2 per capita. Mm-hmm. We've had a few here this last year that have moved to doubling their support. Like Vulcan County is at $4 per capita. Mountain View County moved to $4 per capita. Pardon me? Westlock is not quite there. They're at about $1.50. Fairview, MD of Fairview is at $20 per capita.
On a $10 million budget.
They've been supporters that we do a lot of service for them. You know, it's based on, too, I appreciate what you're saying, but I hope that you will understand, too, some of these areas that are contributing significantly more, they recognize that we are a lifeline for their residents. Because
They don't
right?
have, they don't have ground stuff.
They don't have ground. They hardly ever have, every weekend they're on the radio that they don't have a doctor, right? So you cannot even go there. They're not accepting any patients at all. So then they're dispersing them to either Peace River or Spirit River, right? So they have some significant challenges where we are about a 25-minute flight to get there and bring the critical care right along with, you know. So that's where that comes in, that there's so much significant support coming from the northern areas, is because we are the lifeline for a lot of them that have ground ambulance. One way is 3 hours.
The last time you were here, we talked about a landing pad, and we still currently don't have one. Does that change where you're able to pick up our patients that are in the Wainwright facility?
Definitely, it does. You know, I was just telling Reeve Bars that I am working with some other communities across the province as well that want to have some help and want to be, as a community effort, you know, wanting to get a helipad, right? Because number one, helipads are a significant generational investment in your community. They can be there for the next 30 years with, you know, just minimal upkeep. In the fact that there's no call-out charges then. We don't need any other resources to help us. It is a dedicated area for us to go. So we can go from A to B, however many times we need to. You know, also statistics show that any community that has a helipad, the mission rate goes up in the fact that we are much more accessible to bring critical care to your area because of that helipad and being able to have that dedicated area to land. And we don't need fire, we don't need RCMP, we don't need the ground ambulance. We've had some significant challenges in the last year or two as well, you know, where communities are needing, there's an incident, communities are needing stars. We come, but we're not able to land there. We have to land at the helipad or we have to land in an outlying area somewhere, and now there's no ground ambulance to come and get our crew, to get them to the hospital. So a lot of mitigating factors. We appreciate that Alberta Health Services has a lot of challenges now. There's lots of, being able to have enough ground ambulance or to be able to staff ground ambulance as well. So I know they're really working very diligently to try and mitigate that. So at the same time though, this is also, a lot of these communities I'm working with, we're working on like a 5-year plan where they are looking forward that in 5 years they would have enough fundraising, they would have enough, from the county and from neighboring towns that are going to benefit as well. It's kind of like everybody doing a little something again, right? So last year we just now celebrated with town of Innisfail. They opened their helipad in June. So, and previously, there was Daysland, Viking, Didsbury, like lots of where they had, they had a health foundation that helped. The county put in, all the towns and the little surrounding towns, everybody, and then they did lots of fundraisers. They had Rotary help. There's been significant, I'm working with Athabasca now as well, so it is, if you can see it as a 5 or even a 10-year plan, if that's what it takes. 10 years from now, you will be better for it, and so will your community.
And did you find that our discrepancies in information that came from AHS was different than what you thought perhaps was needed in price and value of what was built,
In my opinion, how do we say this? Okay, Alberta Health Services has 3 main criteria in order for you to even your community to qualify to for them to think about having a helipad. So number 1, you have to be more than 45 minutes away from tertiary care, which I believe you are. You have to have consistently more than 10 interfacility transfers every year, which I think you're just underneath that a little bit. Like 99976, so you're not qualifying for that criteria. And then you must be more than 10 minutes drive time away from the nearest airport. So just on your interfacility statistics, you would not qualify for Alberta Health Services to consider in helping. But then these other communities that I listed to you were under the same thing, that they did not qualify, but it did not stop them from, as a community, recognizing that, And then again, as I said, what we've seen in statistics for municipalities or towns that did not have a helipad, but later on did get one, the missions went up on how we could better serve that community. So lots of things to think about, but even on a 10-year plan, 10 years goes by like that. And your children and grandchildren will benefit from what we do today or what we plan for today.
Did you look at me and say 10 years went by like that? My age that bad?
So she did look at you.
Now, I've been here right along with you. I'm not getting any younger either.
That was a loaded question.
So I want to ask you a couple of questions here, and I'll start with your operational budget. Are you not meeting your operational budget needs through donations and money? I mean, I know you've stated here, like you'd like to come to us for a line item, you want more money, so but yet you've got 10 helicopters well paid for already, and if you're meeting your operational budget, then what are you going to do with the extra money that you raise? Obviously, you're going to every MD or county and asking them for a line item, and then what are you going to do with those funds? Have you got plans for it?
Good question. So, we never know each year whether or not we are going to meet our budget, because there is no planning for, okay, X amount of missions, we're going to plan for this much, and this much money it's going to cost, right? Because we don't know how many missions we're going to do each year. It keeps going up.
I see
Right?
that, but I think
So-
you've got a pretty good idea. I mean, that's all done in your budgeting. You've got that package and you can
Right.
overdo that in a package.
We can. We also always have to plan for the unforeseen. So of course, yes, we're also putting money away in case for anything. It's no different than at home, you know, the washer and dryer and the fridge goes. What are you going to do at the same time? We have 10 helicopters. If one has a cracked tail boom, what if you have 3? That's $1 million a pop, just like that. You know, there's so many different things when you're running helicopters. It is not inexpensive. It's crazy on what you have to do. We have to also maintain them meticulously as we keep going out the door and the mission rate goes up. Then also the maintenance goes up because they all have to have incremental 400 and 800 required maintenance hour inspections and changeovers. So then we always have 2 helicopters, minimum 2, sometimes 3, that are always in the changeover of maintenance. So then we rotate them around to all the different bases. For example, Grand Prairie will do about half the missions that Edmonton or Calgary will see. So as soon as Edmonton and Calgary is getting close to their hourly maintenance, we'll switch them out with Grand Prairie so that we'll have longer time of usage, and we'll put the Grand Prairie one in a place that has higher, you know, volume. So we're moving them around all the time. So out of the 10 helicopters, there's 1 located at each base. There's 2 that are always in maintenance, hourly maintenance, and 2 that are utilized for anything unforeseen as backup. So they rotate around through all provinces at all 6 bases. With that as well, through the COVID years, you know, we have been very honored to have so many long-term fundraising events. We lost a massive amount of fundraising events that after 2 or 3 years of COVID, then, you know, you just lose the momentum. And so then that always comes into play, that you can't always count on what you have coming in. You know, so hundreds of thousands of dollars were lost in those years, and we had to dig into reserves in order to meet budget because we lost so many events. And then when you don't get them back, now you have to replan in other ways. You know, and sometimes the momentum, you know, you might have had a $100,000 on average event each year that now they decide to bring it back after COVID and everything, and we're seeing this quite a bit. Now they might raise 25 or 30, you know, which is still great, but it's certainly not what we had consistently counted on. So, I mean, yes, we have to be very flexible on everything, and the mission rate continues to rise, right? Across our 6 bases last year, over 3,400 missions were flown. 3,400 missions. Like, it's really...
You must have a pretty good slush fund because you are giving out rounds to the fire.
We had to stop that. We had to stop that quite a few years ago.
Actually, we just got one.
Then maybe that's something I don't know about that they did because they had put in that. You used to come out of the lottery fund, and maybe that might be something that they're bringing back because I know we know how much the fire departments appreciated that, and you know, it does help, right? So I'm glad you told me that because I'm not aware of that. If they decided to bring that back, it would have probably come out of the lottery funds, but maybe because we did hit, you know, just a little bit over, that they might have decided to put that program back in place. So I appreciate you letting me know that because I didn't know that.
Well, we don't like to tell anybody because then they want it too, and then we don't get it this year.
Good point, though.
Has anybody got any other comments or questions? Well, Glenda, thanks again for coming down and giving us an update. It's always good to see you and see where the numbers are. So, yeah, like we're locked in for another year, which we'll continue to uphold. And if council wants to make some changes, we can have that discussion. But we'll see how it goes. But thanks once again for coming and seeing us.
Well, thank you very much. I always appreciate it.
All we come back for is a line item, just to make sure we don't forget you. That's pretty easy, as long as you don't have to.
Well, we'll see, we'll see.
Okay, thanks.
Either way, though, you know, it's the sustainability piece that's so important.
Yeah.
At least we do know that's what we can count on, for sure. And that's an important factor for just helping us offset the cost, you know, of the service that we provide in your area. So we are partners, right?
For sure.
Okay, thanks a lot.
Thank you so much. I brought you the latest in newsletters. This one in particular might be of interest because it's about the new Blood on Board, which I didn't really expand on that. So we have a brand new Canadian first, once again, just in last October, for massive hemorrhaging protocol. So we now carry 2 additional items that can be added to the universal blood that we give for severe trauma patients that require more than 2 units of blood.
Oh, okay.
We've also increased, so we now provide up to 4 units of blood for those really severe patients. So that's really a good read. And I brought you a calendar, of course, and please share a calendar with your fire department.
Perfect, thank you.
Okay?
Okay, thank you.
Quick question for
Sure.
the federal government.
Not from our annual service perspective, because we are considered provincial. But federal government, we must acknowledge that they were at the table in purchasing the helicopters.
Right.
Federal government paid for 7 of the 10 helicopters.
Okay, that's good news. Okay, just
Can I
leave
leave
them
this
on
way?
the table there, Glenda.
I'll make sure nobody gets one. I will.
Thank you.
Okay, thanks a lot.
Great to see you all.
You too.
You too.
If you ever have any other questions, I'll follow up on the radio
Okay,
thing.
thank you.
Kelly knows how to get hold of me.
Yeah, okay, all right, thanks a lot.
Oh, yes, thank you so much.
I've never in trouble.
Come on in, Dana.
Good morning.
She's back.
And how are you doing this morning?
I'm good, how are you?
I'm doing wonderful. Okay, we have Dana with us for development report. Development report's in front of you. Any questions or comments anybody has?
Is the applications for acreages going up?
The applications for developments is going up, but not subdivisions. Lots of inquiries.
That's good, it's just the year.
It is the season, yeah, indeed.
Okay, anybody else have any questions or comments? I get a motion to approve it, please. Bruce, any further discussion? All in favor? Carried. Thank you. Motion to approve the pay sheets. Bill,
Bill, good man.
are you going to get paid this month? Okay, any further discussion? All in favor? Opposed, that's carried. Okay, report seed cleaning plant. I did not make the last meeting, but I think the last time I heard they had about 70,000 on the books, so they're busy cleaning away. As far as I know, everything's going pretty good. So, Edgerton.
Yeah, we're up 18,000 bushels from last year, and all of April seems to be booked up pretty solid. So.
Okay. FCS.
Well, the next meeting's Thursday night. I think the only thing is, the meetings in the fall, we didn't get the Fantasy Hotel, so they're alternate places, so.
Okay. Battle River Foundation.
Go ahead, Red. We had our meeting last night. All was well. Looking for capital, new business planning and things like that.
We found out last night that we're not getting any government money funding for to help with any maintenance program. All new maintenance money for Wainwright was shut off.
We were part of the lodge review in a
It's because we
4 or
own the
5
building,
hours.
Mike, is why. They're having trouble speeding up for their own buildings.
Oh,
They're way behind on that, so there's very few things we qualify for. The last one was the fire suppression of 1.2 million, and the elevator for 320, I think it ended up being somewhere in there. But the reason we qualified for the elevator, otherwise it would be coming back to the municipality, was because we had way under and there was enough left over from the fire suppression. They didn't want it sent back, so they gave it to us for the project of the elevator. So other than that, I don't know if we have anything that really qualifies under theirs, but we're hoping that they'll look at it and give us something. Is that not right, Robin?
What's your occupancy rate?
89. 4 died last week and 3 are being moved in this week, which was a coincidence because they hadn't even applied. But on the death of the 4th person, we had these 3 applicants come, so they'll probably move in within the next week. Yeah, it's been a lot of hard luck there at the lodge as far as people leaving.
And how's your grocery bill? Do you find the groceries are still going up, or are they leveled out, or are they falling?
No, they're still going up. It's not good, but Robin can talk more on that. She's the chairperson. She should have looked at the grocery bill. She signs them, I don't.
They're working really hard. The colonies supply us with fresh vegetables, and they shop.
We're shopping.
They
all
shop
over.
hard looking for good
deals.
deals. For good deals and things that are.
The whole colony supplies us with quite a bit.
Yeah.
okay. Landfill. Okay, we finally got the material come in from the Green Shields project. Was more than we expect, close to 8,000 instead of 7, but it's all done. They're using it. We hired some seasonal staff. The roundup is scheduled for May 4th, between 10 and 2. We've just interviewed for a new person to replace James. We had interviews last week, so we're hoping to get something back in the next day or 2.
May 4th, Bob, is that chemical roundup and
yeah.
paints and stuff? Is that it?
Yeah, it's May 4th for the household roundup, from 10 till 2. Anything else, Robin?
Nope.
That you recall? No. Okay. East Central 911.
Most of the talk was about AFRAX, of course, and this recorder that we're supposed to pick up. They sent out for pricing on it, and we're trying to recruit more municipalities into our service. So Stephanie's going to do some road trips this year and see if she can acquire them. So.
Okay. East Central 911, Community Health Foundation.
Well, I guess it's the gala. It's the gala time, and that's one of the most exciting events in Wainwright, and we're sold out.
Good.
This is 3rd year, I believe, that we've had it in the blue arena or the green arena or whatever. I think it's the green one. And we're sold out, so we're quite excited about the event, and yeah, I hope it'll raise a lots of money for the hospital.
Okay.
Do you need more help decorating on Friday, Bill?
That would be very appreciative of that, Richard. Yeah, we can always use help. It's a big day of decorating.
Thanks for volunteering your side of the table.
There you go. Look at you go. Okay, anything else?
No, not really.
Okay.
You got a new doctor coming?
What's that?
Got a new doctor coming?
Yeah, we do have a new, well, we don't know for sure.
Don't
It's
know
not.
that yet.
Oh, it's
I'm
not
I
official.
can't really say for sure.
I'm sorry. I didn't
That's
know it
all
was
right.
official.
That's all right. There's
We-
a possibility.
We have a new international nurse starting shortly.
Yeah,
She's
you do.
moving in.
Yeah. One more that you didn't know about.
Yep.
Yeah.
That's always good news. If
Yeah.
you're spreading good news.
Yeah, no, we're always spreading good news. That's what we like. It's a good news story.
Sorry about that.
Yeah.
Okay.
No,
Just, okay, Northern Lights, I guess we got its update. Anything else?
There's a in-person board meeting May 22nd, and it's an all-day meeting with a keynote speaker and things like that. So.
You're going to?
Yes,
Okay.
I am.
Economic Development.
Meetings the end of the month.
Okay.
So nothing since the last one.
Okay, I'd like to give you an update from the landfill. I just got an email. It looks like we've hired somebody to replace James.
Yeah, good. And that's a full-time position?
Yep, it just came in a few minutes ago.
Who'd you hire?
Guy by the name of John Rush. He had 27 years experience in the Coronation landfill. So he's accepted a position, starts May 13th.
And all the oil field stuff and coordination, that's where all the waste is.
Okay, anything else? Motion to approve reports.
Billy.
Sir William, thank you. All in favor?
What
Opposed,
division are you
carried.
from?
I can't read it from
Okay.
Motion going camera?
Yes, we do need one. Thank you, Oscar.
in
All in
camera.
favor? Okay, those who don't